Supervisor Jurdy, do you have any questions?
No.
Okay, Supervisor Williams.
Yeah, I have a question about the ventilators, and I know the public shares this concern. I've heard from a great number of constituents. Are we currently at the maximum equipment based on the personnel we have, or is there some room to augment? And I'll give the coast as an example. I understand they have 4 ventilators today. I asked how many more could they operate, and I was told between 6 and 10. Is that accurate, or do we feel that we don't have the personnel, even if we had the additional machinery?
Dr. Flaherty, are you still on?
Do you want me to? Thank you for the question, Supervisor Williams. This is Jen Banks, and I will try to address your question, and Dr. Flaherty can then provide follow-up. We have we issued a survey to all of our healthcare facilities late Sunday afternoon to assess our surge capacity in regards to ventilators in Mendocino County. At this time, our 3 hospitals have responded to the survey. And just to put some preliminary numbers out there and what their surge capacity description looks like, so you have an understanding of some of the work that's being done to address this concern. Mendocino Coast District Hospital has 14 ventilators per their survey response. And they also have the capability to use BiPAP. For those that don't know, BiPAP is also a machine that provides ventilatory support to patients who are having respiratory distress issues. So in their surge capacity description, they've responded to the county that they have 3 respiratory therapists. They're looking to hire a 4th. They are looking to contract FTEs who can provide surge support to that facility. Nursing can also potentially monitor, and they are actively working on a tent going up that could be used as a ward to cohort COVID patients. So there's a lot of planning going on like this with each individual hospital in the county. I do stay very closely connected with Dr. Duhan and Dr. Flaherty. We have a call with our hospitals almost every day, but a very specific call that happens 9 a.m. on Mondays, Wednesdays, and Fridays with the CNOs of our hospital facilities. Those CNOs are Lynn Finley, Linda Givens, and Lindsay Spencer, and it's our time to really discuss these very sensitive topics to develop appropriate surge plans based on the forecasted need for our county.
I understand. So back to my question, are the hospitals already in a situation where they're maxed out? If they had more equipment, they could not use it based on personnel? Or is there room to augment the equipment we have? And the reason I bring it up is we see the federal model seems to be every state for itself, competing and bidding to get equipment. If we wait until the Bay Area has the surge, we might find that there is no longer a supply of equipment. And so placing those orders today seems critical. You have New York talking about bringing in retirees to run ventilators. I don't know if California will see that, but I would hate to be in a position where the licensing rules are relaxed due to necessity, and yet we can't benefit because we didn't plan ahead on acquisition.
So thank you for the follow-up. I can't discuss the staffing capabilities of each agency. I'm not employed by those agencies, but I can tell you that they are assessing what they can bring in for additional staff to help support surge if needed at those facilities. I also wanted to bring up, we do have a program, it's called the DHV, and it's a disaster healthcare volunteer program. And it's managed by North Coast Opportunities by contract. And the DHV is very active today. There's a lot of communication. I am a member of the DHV to respond as a licensed paramedic and a disaster coordinator if needed in the state. So those communications have been being exchanged with the members, and we are trying to assess who we have available through our DHV support group to possibly volunteer their time to support this surge. The DHV list is a wide array of people, from doctors, respiratory therapists, nurses, EMTs, that can serve in different roles when we reach surge and need that support. So I do know that they are very engaged, and they are continually assessing what volunteers we have available today to provide support when called upon.
Understood. So we may get some additional staffing. When do you anticipate orders being placed for the additional equipment to back that staffing?
Well, as of today, Supervisor Williams, we have completed this survey with our hospital facilities, so we have a very clear understanding of how many ventilators and how many BiPAP machines we have available in Mendocino County. We are currently working with our hospitals to develop and understand each facility and their own surge capacity. I've heard from the state, the number right now, the focused control group number is to anticipate 30% surge per each facility. And I know that our facilities are working to achieve that. Once we have a good understanding of their capabilities with their staffing, I think that gives us a strong number to move forward a resource request through the region up to the state if we do decide we need to order extra ventilators.
And roughly what would that date? Nobody's going to hold staff to it, but just so that we have a handle on the time frame and budgeting for the equipment, when do we expect those orders to take place? I understand we need to survey and analyze, look at staffing, but ultimately there's a drop dead date where we have to place an order or we won't get the equipment in time for the surge.
Well, so we have reached out the Mohawk branch. You have a team working day and night to ensure that we have resources continually coming into the county. So I want you to be aware of that. We've also been communicating directly with Jim Wood's office. They've been checking in every day to ensure we're getting the resources that we've requested to Mendocino County. And we have had preliminary discussions with that office to ensure we understand the process and the direction that we need to move should we need ventilators brought to Mendocino County.
Understood. Approximately what date?
Supervisor Williams?
I definitely don't have a date, but I think we need to have the proper work done to ensure we have the proper staff and the beds available to put patients on ventilators that need them in this county. Thank you.
Okay, thank you. Supervisor Brown?
No.
Okay, Supervisor McCowan?
Thank you, Mr. Chair. So I think I heard that the hospitals are planning for a 30% surge. Is that accurate?
Jen?
Thank you, Supervisor. We are anticipating a 30% surge, so we're asking the hospitals to provide us a surge plan for 30% surge.
Well, thank you. So if we currently have 45 ventilators available in the staff to operate them, we plan for a 30% surge. That's 14 or 15 additional ventilators, correct?
So, and just to clarify, that is a total surge for people who might need to be hospitalized because of COVID infection, not the percentage that Dr. Doohan addressed earlier in this call for the lower number of patients that might need to be put on a ventilator.
Okay, and also it's my understanding that we get to the number of 45 ventilators by essentially stripping them out of operating rooms. So once we have connected the first 45 patients to the ventilators, those ventilators are now dedicated for approximately 8 weeks. If emergency accident victims or any heart attack, anything else needing surgery comes into the hospital, we no longer have ventilators in the operating rooms. The point I'm making, the preparations that we're taking, we hope will be sufficient if we're able to flatten the curve through the public health officer order and compliance with it. However, I think we would be the first area that has successfully, substantially flattened the curve. If we're able to do that, we hope